Cardiothoracic surgery entails all aspects of surgery on the heart or structures in the chest. That includes heart itself, lungs, esophagus, and chest wall. Basically creating all diseases such as coronary artery disease, valvular heart disease in the heart itself, problems in the lung such as benign or malignant diseases, congenital diseases, and diseases caused by trauma or other incidents causing deformities in the entire chest cavity. In the field of cardiac surgery, the most common surgery is coronary artery bypass graft surgery. Most patients come to see the cardiology first, and then they are referred to surgery if they need it. And we have virtually all procedures done in this institution for treatment of heart disease or lung disease and other structures in the chest. The heart surgery department at Good Samaritan Regional Medical Center is affiliated with Stanford University. This collaboration between our heart surgery here and Stanford University creates a very high standard and the highest quality possible for this hospital and this community.